Hello everyone, welcome to my presentation, Understanding Attention Deficit Hyperactivity Disorder in Children and Adolescents. My hope from this project is that you will leave with a better understanding of what ADHD is, the stigma and myths often associated with this disorder will lessen, and that empathy and support will prevail. Let's get started. So what is ADHD? Attention Deficit Hyperactivity Disorder, or ADHD, is one of the most common neurodevelopmental disorders that affect children and adolescents. The disorder is marked by difficulty with attention, hyperactivity, impulsivity, and self-control. And 2/3 who receive a diagnosis in childhood will continue to have symptoms into adulthood. Essentially, ADHD makes it challenging for kids to hold their attention and control their behavior and sometimes emotions. This, of course, can lead to significant struggles in all areas of life, including home, social, and school domains. Children are often thought to be lazy or disobedient, when in reality they have a condition that affects how their brain functions, which can lead to various impairments in functioning. The cause of ADHD is currently unknown, though most experts assert that its origin centers around the interaction of various environmental, biological, and social factors. Environmental factors include maternal smoking during pregnancy and breastfeeding, low birth rate, and exposure to lead. And low levels of the neurotransmitters epinephrine, norepinephrine, and dopamine are thought to be biological contributors. While some of the psychosocial aspects thought to contribute to ADHD or exacerbate its severity include poverty, an abusive or stressful home life, and absent or unsupportive parenting. Additionally, there is high heritability associated with ADHD, with 50% of children having at least one parent with the diagnosis. Despite an abundance of evidence showing the biological and neurological underpinnings of the disorder, the assumption that ADHD is simply caused by sociological factors, poor parenting, or willfully disobedient behavior persists. It's important to recognize that there is no single factor that causes ADHD to develop, nor is it caused by a bad child or lack of discipline. The assessment for ADHD involves several steps, which include clinical interviews with the child with a detailed developmental history taken, parent and teacher ratings that evaluate symptoms of inattention, hyperactivity, and control, and physical examination to rule out other health problems and behavioral observations. ADHD is not a new disorder. Historical texts indicate descriptions of ADHD symptomology as far back as Greek times. And Hippocrates thought the origin of hyperactive and impulsive type symptoms to be caused by an overbalance of fire and water. Although these descriptions exist, the symptoms of ADHD were first described clinically in 1902 by the English pediatrician Sir George Frederick Still, who is pictured here. Still found that a group of patients displayed difficulty concentrating, seemed defiant in nature, and somewhat unmoved by attempts at correction. Various terms were used to describe symptomology, including minimal brain damage, minimal brain disorder, and hyperkinesis. It wasn't until the third edition of the DSM-3 that introduced the term attention deficit disorder, or ADD, with or without hyperactivity. And in the revised version, the modern day term of attention deficit hyperactivity disorder came into use. ADHD has also been depicted in various forms of art and literature. Seen here is the 1670 work, Village School, by Dutch master Jan Steen, which shows children displaying inattentiveness and hyperactivity in their school setting. Shakespeare, too, included a description of attentional issues in a character from the play King Henry VIII. In Johann Wolfgang von Goethe's masterpiece Faust, his character Euphorion displays a range of ADHD behaviors, including impulsivity and hyperactivity. Additionally, various depictions are present in the Bible and medical descriptions in children's books authored by Heinrich Hoffmann, a psychiatrist. Many well-known, highly creative, intelligent, and gifted individuals live and thrive with ADHD. The famous gymnast and gold medalist Simone Biles, astronaut Scott Kelly, actor and producer Johnny Depp, journalist Lisa Ling, and musician Justin Timberlake are just a few who have learned how to navigate their differences and have found incredible success despite their ADHD diagnosis in childhood. The DSM-5 currently lists 3 distinct presentations or subtypes for ADHD. These include the primarily inattentive presentation, the hyperactive impulsive presentation, and the combined presentation. The primarily inattentive type is characterized by attentional issues and challenges with distraction, absent-mindedness, and organization. This may present as losing things, failure to complete homework, difficulty holding attention, and being generally forgetful. Youth with this subtype display symptoms prior to the age of 12 across multiple settings, and it significantly disrupts their ability to perform in several domains. The predominantly hyperactive impulsive presentation, as the name suggests, is characterized by behaviors that are hyperactive and impulsive in nature. This includes excessive talking and movement, always on the go, not playing quietly, difficulty waiting one's turn, and fidgetedness, which is seen regardless of the situation the child or teen may be in. Finally, we have the combined presentation. In this type, individuals who display symptoms from both the inattentive and hyperactive impulsive types will receive this diagnosis. According to the CDC, in the United States, approximately 6 million children between the ages of 2 and 17 have been diagnosed with ADHD, with 388,000 between 2 and 5 years old, 2.4 million between 6 and 11 years old, and 3.3 million children between 12 and 17 years old. Worldwide, the prevalence among youth is approximately 5.3%, with it disproportionately affecting boys. Several conditions co-occur with ADHD, including depression, specific learning disorders, obsessive-compulsive disorder, also known as OCD, difficulties with interpersonal relationships, conduct disorder, sleep disorders, obesity, food addiction, substance use disorder, and dependence on electronic media, which include internet and social media addiction. Interventions for youth with ADHD typically involve a multimodal treatment approach that include medication and behavioral strategies that target the home, school, and social environments. Psychostimulant medications such as Ritalin have been clinically shown to be effective at minimizing various attentional, impulse, and hyperactivity symptoms and maximizing academic performance. Though some evidence suggests it may impair growth related to height, this class of medication is typically well tolerated. Additionally, providing psychoeducation and skills training for parents has been shown to improve compliance, reduce symptoms, and alleviate parental stress. And direct communication with the school and caregivers is essential. Important to note, too, is the need to address challenges related to the social environment. As youth with ADHD may struggle with interpersonal relationships, programs that teach social skills should also be implemented. Overall, it is essential that a multimodal approach be used for treatment and that medication is not used in the absence of psychosocial and psychoeducational interventions. So how can you support your child at home? The good news is that there are many strategies that you can use. Providing support that targets the specific areas that are challenging can be incredibly helpful. For example, if your child struggles with organization, you can create a schedule or routine and provide consistent structure. If distractibility is challenging, employ the entire family to be mindful of noises or clutter that can make concentration difficult. Promoting general wellness through proper diet and exercise and good hygiene are also essential. Additionally, help your child discover their talents and strengths and help them develop them. And most importantly, always provide unconditional love and support. Some other ideas include providing clear expectations and creating a reward system for chores or use other incentives. Kids with ADHD need help and support from their families. It's critical to be fully engaged in their care and management. What about the support in the school environment? Did you know that 50% of teachers in the United States report having received no guidance on how to best support a child with ADHD in the classroom? One of the most important things you can do is talk with teachers and other educational staff to see how they can help your child succeed. Some common classroom strategies that can be employed include modifying the length of assignments, breaking up long projects or tests into shorter parts, providing extended time for timed assessments, partnering the child up with a positive peer, allowing breaks and providing opportunities for movement, creating a low distraction area in the classroom, not using recess as a punishment, creating and posting positive classroom rules with clear directions, establishing a predictable routine, providing visual reminders, and also being creative with learning. Mix it up with group projects, class participation, and hands-on learning to keep kids with ADHD engaged. Important too is to take care of yourself. It is essential that you take breaks, take care of your own physical and emotional needs, and get the support you need so that you can be there for your child. Be sure to take breaks, join a support group so that you can talk with others going through the same things. Learn everything you can about ADHD so you can be your child's best advocate, and seek professional help if you feel overwhelmed, anxious, or depressed. Finally, I want to take a minute to talk about inclusion. So, what is inclusion anyway? Well, many people think it simply means to include someone, but it's much more than that, really. Beyond simply inviting or allowing someone in, inclusion also means to value, support, and respect the person regardless of their differences. So, why am I bringing this up in a presentation about ADHD in kids? Like other kids with physical, emotional, learning, or intellectual differences, those with ADHD often face exclusion at home, school, and among their peer group. In educational settings, the exclusion of children with ADHD is especially problematic. Oftentimes, kids who struggle with things like talking too much, being too loud, unable to follow directions, or difficulty staying in their seat are viewed as a nuisance and distraction to their classmates, getting them kicked out of the classroom, relegating them to a special education classroom, or removed from in-person school altogether. This often extends into the social world of the child. Peers not understanding the child's differences or their parents telling them to stay away leads to social isolation. This too affects the family, who may also feel excluded and removed from potential social support. So, what can you do to help a child with ADHD? First, advocate for participation in mainstream educational settings. Often kids with ADHD can succeed with proper supports like in-classroom aid, various accommodations, learning materials in alternative formats, and plenty of opportunities to move and take breaks. Remaining in the classroom will ensure adequate levels of instruction and peer interaction to enhance academic and social growth. Also, don't hide your child's diagnosis. This just leads to feelings of shame and isolation for both the child and family. Educate those around you about ADHD, including extended family, educational staff, and the parents of their peers. And above all, don't think or let others think that kids with ADHD are just bad kids who need more discipline. Encourage others to embrace the child and the differences that ADHD may bring. If you would like more information about ADHD or need support, please check out the following websites. I hope you enjoyed this presentation on child and adolescent ADHD and appreciate your interest and attention. If you have any questions, you can reach me at nclopez2@asu.edu. Thank you.